You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. According to my first guest, he believes that nobody should be wearing traditional dentures that aren't attached to anything, especially a loose-fitting denture. He says no more dentures. With us, we have an expert on this particular topic, Dr. Alexander. Dr. Alexander, welcome to the program.
Great. It's great to be here, Randy.
Now, before we get into today's topic, for people that don't know your practice, who's the typical patient? Because you do more than just mini implants.
Yes, I do.
You kind of do everything there.
I'm a general dentist.
Okay.
Who's my typical patient? If I was asked what's the typical patient that I see kids anywhere from age 3 to 93. And I say that facetiously, kids from 3 to 93, nobody likes to come to the dentist. Whether it's your mother that dragged you in at age 3, your spouse that made the appointment for you, or you're just showing up because you have to. And
do you still hear that, by the way? Like, no offense, doctor, I don't like the dentist.
Every day.
Are you kidding me? People say that?
They say, Doc, I like you or something, but I don't like the dentist. So you get used to that.
Do you have a comeback, a funny comeback after all these years?
No. I need to come up with one. If you have one, I'd like to use it, but it's a dirty job, but somebody's got to do it. It's about the only comeback we have.
So as a general dentist, you do everything, from small stuff to big things?
We do everything. When someone comes in, if I want to start from small to big, I would say the first thing you do is you come in and people say, I assume go to the dentist.
Yes.
And so you go to your dentist, your general dentist, and the first thing you do is, well, we do checkups. Do we do checkups and cleanings? Absolutely. So if we check your teeth and we clean your teeth and we say, there's not much wrong, you have some gingivitis, you need some periodontal work, you can have you come back, we do that. If you say like, okay, I don't like the color of my teeth, they're kind of dingy and yellow, everybody else looks younger and healthier and smiles a lot with bright white teeth. Can you whiten teeth? We do cosmetics, we do bleaching to whiten teeth, we do other kind of cosmetic work. Say in your checkup, we say like, okay, you got a cavity, we need a filling. As a general dentist, we do fillings. We do white fillings, okay, because people like those better, they look nicer, and they actually...
So no more metal fillings?
We gave up doing metal fillings at the turn of the century. We said, it's not a joke, I really did that. I need to pick a time that said I'm gonna stop using that silver stuff. And so January 1st, 2000, we threw it all out. So we've been white ever since then.
I went to your website. I mean, you have all the new gadgets, in a way, to make dentistry easy or something. We like
to make things better easier for the patients and better for us. So we like to keep on top of whatever is new. So we can do fillings. Say, okay, I need a bigger filling. Okay, the cavity is really deep, it's into the nerve. You need a root canal. We can do that. The cavity is bigger, and so that I can't do a filling, there's not enough tooth left to restore it. We need to do a crown. So we can call those crowns or caps. It's the same thing. We do that. Next case, it can get even worse. There's not enough tooth left to save. This tooth, it's just you waited too long or something happened. It's got to come out. That's oral surgery. We do that.
Now, you've had a lot of training, by the way, in this type of like bone grafting. So is your concept to kind of be able to do everything under one roof?
We like to. Our mission statement, is that we want to be able to take care of every need. You come in the door, we'd like to be able to do everything for you and do it better than anyone else. If there's some specialist that can do it better for you and faster, yes, you can go there or something. But we'd like to, if possible, take care of anything that comes in the door and take care of that for you, yes. So oral surgery, yes, tooth's got to come out. We can take care of that. Now we got a new problem. Okay, there's a space. Nobody wants a space. And so we can replace that space with what's called a bridge. Instead of a crown just on one tooth, you can have several crowns together connected to the teeth on either side of the space. So it looks like all the teeth are still there, but they're really attached together. So we can do bridges, or rather than destroy two teeth adjacent to the missing space, we can put in a single tooth implant.
So you like implants, by the way, to replace missing teeth?
I like to do the least invasive thing that I can to a patient to get them back to health. And I found that if you're missing one tooth, if you ask any person, well, if I'm missing one, why can't you just put that back in? Why do I have to work on several others?
Yeah.
And so with implants, I can do that. If there was one tooth missing, we can put an implant back in, put a crown on top of that.
Does it hurt?
Does it hurt? Doesn't hurt? I don't feel a thing. Like,
Okay, so you don't feel anything. But the patient, I mean, it seems it's not that painful
to
get a dental implant.
It was more painful to take the tooth out. Much more painful to take the tooth out than to put the implant back in.
So during the procedure, they're numb, obviously.
Yeah.
But afterwards, I mean, they're
I wouldn't even do this on my mother-in-law or something without anesthetic.
Okay.
That was a bad joke. You don't want to hear that one.
No, that's okay. That's good.
But they can't, you know, as far as how much pain is involved, and it takes more anesthesia to remove a tooth than it does to put an implant back in. The nerves, most of your nerves are actually in the soft tissue, and there are some nerves in bone, but bone doesn't feel us. And when we're putting the implant in, no.
Now, a bridge is supposed to last about 7 to 12 years. How long does a mini implant, is it supposed to last if everything goes well?
It should last as long as that. It could last forever. I mean, that would be our goal, to get an implant to last forever.
Now, you've been doing implants for how long?
I've been doing implants in general for over 20 years. Minis just since 2010.
So would you say then a mini implant to just replace one tooth is better than a bridge?
Absolutely.
What about expense? I mean, is it more money to get a, if you're missing one tooth, just put
Actually, if we take a single tooth, if we remove a tooth and we try to put a fixed bridge in instead, it'll cost less to put a standard implant in and a crown on top of that than it would to do the 3-unit bridge, fixed bridge. And if I do it as a mini, it'll cost even less.
Then why aren't they all doing it? Why aren't they all just getting it's like getting your tooth back, right? Why aren't they all doing it this way? They're afraid?
Why aren't they all doing it?
Yeah.
They are. In my office, they are.
Okay.
And I'll give them the option or something to do it the other way. And most people, when given the choice between, once you lay it out, it's a no-brainer.
Okay.
Which are you going to choose? You're going to choose something that's more expensive and worse for you? Or are you going to choose something that's less expensive and better?
Now, the denture wearers, they benefit the most, you say?
Yeah, actually, yeah. We get sidetracked. You get me talking on different things that we do. That if you're missing one tooth, we can replace that, with an implant or with a mini dental implant. So someone comes in and they're missing several teeth. Now we have a couple options for that. We can either make what we call a partial denture, which is a appliance that comes in and comes out. It can move. Or we can just put implants in and put crowns and bridges back on top of that. The difference being, one moves when you eat and talk. The other, it's just replacing the teeth that were already there. You're back to where you started from. You have your own teeth back.
So this is the newest, hottest trend in dentistry, is implants and mini implants.
The newest trend, trend in dentistry is trying to restore what you started with. We'd like to get people back to the point in health that they started with. And so if you think about it, it's sort of like if I was missing an arm or a leg or something and I give you a prosthesis, I can strap something on that just sort of hangs there and it looks like it, but it doesn't work. That's what a partial denture is. That's what a denture is.
Okay.
If I can get it so that it's attached so that it all works and it hooks up to your nerves and now it functions just like what you had, that's what an implant is. You get back so that now the teeth, they don't come out. It's not like something you can take this off.
Nice.
It's there again. You can chew just the way you can do everything else that you did with your teeth that you used to have with your own teeth. It's just that now they're attached, instead of to the roots, they're attached to titanium.
Now, at the top of the show, we said no more dentures. No more dentures the way we know them today. Elaborate on that.
Okay. If we're going down the continuum of what can go wrong with your mouth, of course, the end of the road is someone comes in and their teeth are either in very poor shape or there are no teeth at all. They've lost them all. In the past, the only choices we had is you go back to like the George Washington thing. I have no teeth. I need to have dentures. What a denture is a denture is a big piece of plastic that sits on top of your gum that sort of looks like teeth or something, but unfortunately, they don't function at all like teeth. And I don't know if you've ever thought of it because you have your own teeth, but people that don't have teeth, that have dentures, they wonder like, well, they just work, or I know my grandparents had them because I used to go over and I'd sneak a look in the bathroom or something and I'd see this little cup and there would be like these funny looking things in it. I was like, what's that? He's like, oh shoot, that's Grandpa's teeth. He's not wearing them. He's like, well, that's kind of weird. How do they work? Well, they don't really work because if you think about it, it's a piece of plastic that looks sort of like teeth, but it doesn't function anything like it.
So you don't like dentures at all?
It's not that I don't like dentures. Nobody likes dentures. Patients don't like dentures. They don't come in and say like, gee doc, I love to have my dentures. Once someone is into dentures, they can't do all the things that they used to. If you think about it, your diet goes from being able to eat a steak or eat an apple or corn on the cob to now I can eat fish, I can eat mushy pasta, I can eat cottage cheese and yogurt. Now, Randy, given the choice of that, would you rather have a steak or do you want to eat something mushy? No, nobody likes dentures.
Now, are there a lot of denture wearers like where you are in your area?
There are a lot of denture wearers everywhere. In my area, probably in my town alone, if I took East Greenbush, I could probably fill the Joe Bruno Stadium with the number of denture wearers.
Like upper and lower denture, is that right?
Upper and lower. I could probably do that, yeah.
But if dental implants are so good, right? Like putting implants and then just locking them in, right? Mm-hmm. Well, then why aren't they all doing it? What's your take on that? Why aren't the denture wearers coming in to get this done?
It's a good question, Randy. I'm glad you asked that because once you hear about the advantages of it and see what it can do to people, you're just like, why wouldn't everybody do this? Well, the reason they don't is a denture wearer, you just listened to my talk about the continuum of patients going to their office from just getting their teeth whitened to the ones that need dentures. By the time you have dentures, that didn't happen overnight. These patients that come in that have dentures, it wasn't like, yesterday I had all my teeth and I woke up, I don't know, it's like a bad dream. They all fell out, they're gone. It doesn't happen.
Okay.
These patients have come in, they've had fillings done, they've had crowns done that failed, they had bridges that failed, they had root canals that failed. And one by one, they had tooth after tooth.
A lot of money.
They have spent a fortune in the dental office in time and in money, and now they finally get to the end or something, the last few teeth go, and it's almost like phew. Even though what I'm left with is bad, I don't have the pain that I've been going through. I don't have to go to the dentist and spend any more money. They think that they're at the end of the road because they finally have the denture, that's it, nothing else can happen. And so these denture patients, once they hit that, they stop coming to the dentist.
So they don't know their options.
If they've been out of the loop for a while, they have no idea what's going on. And they just think that, well, this is it. If it's not staying in, I watch TV, and on TV they say if your dentures don't stay in well or something, all these different companies make denture adhesive. You just buy a tube of our special
So you don't
stuff.
like that. I mean, so your idea, I don't want to put words in your mouth, but your idea is the dentures come in, you put in mini implants, and they lock in. You can either get a fixed set of teeth or snap in, snap out. Is that right?
It depends on what you want and what fits your situation. But yeah, someone comes in and has no teeth, we can do two things. We can either put a full mouth of implants in with the snap on top of that, and they don't come out. I put them in, I can't take them out, you can't take them out, they're permanent. Or we can, put a few in, make a denture that snaps on top of it, which is still so much better than the denture that was floating around.
You do a lot of that in your office.
We do this all the time. Yep. Changes people's lives. They will come in and in one visit, put in the implants. They can come in actually, if you want to, in one visit, put the implants in, retrofit it to their denture. They walk out with their own denture that they've had before or something, and now it doesn't move.
So no more adhesive or anything like that?
No more adhesive, which...
For the sake of time, we have to talk about options for denture wearers. If a denture wearer, somebody wearing a denture, false teeth, goes into your office, what's that discussion like as far as options?
Okay, so Randy, so if someone comes into my office and they are wearing a denture and they're not happy because, as I said, no one's happy wearing a denture because it's moving around and they can't eat the things that they want to, okay. They're not happy with it. He said, I'd like to somehow stabilize it. So option number one, someone comes in, they have a denture that they don't like how it fits, they can't function well with it. We could do 2 implants standard, one here, one there, make a full arch of teeth, a full denture that snaps on and snaps off that. So with that, now with 2 implants and a denture that snaps on top of that, you can go back to eating all the things that you once were happy with. You can eat things that are harder and crunchy, and you don't have to use all that denture adhesive anymore. The next option would be someone comes in, that same situation, instead of doing 2 standard size implants, we could do 4 mini implants, and we make a denture that snaps in and snaps out. Actually,
Okay.
Looks about like this.
And just
You
snaps
push
right
that,
in.
and if we just snap this back on,
Let me see this. So this is pretty accurate of what it is. I'm not exaggerating here. So can it be too tough for people to take out?
as a matter of fact, sometimes they fit so tight that we actually have to loosen them up so that the little attachments, the patients that are having it, some are older, they can't grab onto as much. We have to either make some kind of notch in the denture that they can get their thumbs into, or make it so that it's, yeah.
So you like the mini implants over just the 2 implants? You'd rather have 4 like minis that snap in, snap out?
I can get the same or better retention for how tight this denture is with 4 minis or 2 standard.
So is it less expensive than 4 mini implants over the 2 traditional implants?
It's less expensive. Not only is it less expensive, but it's quicker. These heal up quicker. You can go in rather than put them in and wait for months for the bone to heal on the standard implants. I can put in 4 minis, fit it to your existing denture. You walk out that day with your denture stabilized. So
how soon can you eat if you do that procedure? If everything works out?
if everything works out, you walk out, you can eat right then. I mean, if we did this in the morning, you can have lunch. If we do this in the afternoon, how soon? It's, well, how soon dinner is. There is no wait. That's right. There's no waiting at all. You can walk out that day, stabilized, and eat whatever you're planning. As a matter of fact, I mean, the first time when I started doing these, I was a little bit nervous, and I didn't think, like, so I was doing this. This was on the father of my dental hygienist, and we put some implants in it, gave him a stabilization. He walked out and he called me back and he said, "I'm eating apples." And I said, like, you really got, I didn't tell you could do that. He said, "But they stay in so great." He said, "I'm back to eating everything that I wanted." He said, "It didn't hurt." He said, "I went right out and ate after I ever left your office, in spite of what you told me not to do," or something. And he said, "It's just fine." And we saw him, for follow-up. He was right. It's just fine. He was one of my earlier cases, and I didn't know at that time that, yeah, you can get away with it.
So now that's routine?
We still I'm pretty conservative, Randy. I mean, I don't want someone to come in, have this procedure done, and plan on that they're going to go out and have a big steak dinner that night. I mean, can it be done? I'd like them to be a little bit easy, to just take it a little bit easy for a while.
But in a few days, they can eat whatever they want.
Once they're feeling back to normal, yeah. Now, if somebody wants to move up to another option that they have, rather than 4, if they want to, we want something that really, we can add more implants. If we add more implants, then we can have something in and snap out on top of that. Or if there are enough, we can put a full arch of teeth on that don't come out.
So it's just a little bit more money then to get a fixed set of teeth.
We put in more implants, yeah, it's going to be a little bit more money. But if you think about it, you're getting something completely different. You're now going from something that a part of your body that you can take off to something that it's you again.
And if you give them the fixed set of teeth, this full arch of teeth supported by mini implants, so now they can eat whatever, right? I mean, or they have to be careful?
They're back to what they once were.
Can they bite with their front teeth like into a carrot, a raw carrot?
Can they bite into as much as you could with your own teeth? I mean, you can go out and bite with your own teeth into a raw carrot or some really crunchy thing and chip that. It's possible to chip things, yes, but you're basically back to where you once started, yes.
We are short on time, but how old can you be to get these dental implants, to get a fixed set of teeth that don't come in and out?
How old can be
Yes.
at the upper end or something?
Yeah.
As long as you're alive and breathing. I think the oldest patient that I've ever done this on is 93. She actually was an interesting story. She came in and she said, "Craig, I've known you since you were 3. She said, "My teeth are coming apart or something, and I need teeth back, and I'm not having something that can come in and come out. And can you put some mini implants in, or can you put anything in?" We put some mini implants in her to stabilize her. She walked out. We saw her the next week in the grocery store saying, "You didn't come back in or call when I returned asked to see how you're doing." She said, "I'm fine. What do you mean?" She said, "They're just like my teeth were before." So 93.
So we've talked a lot about denture wearers. I want to ask you about the people, though, because you say this is a big part of your practice. People come to you and their teeth are literally falling out. And they know they don't want dentures. Are their gums too bad to get this procedure?
The funny thing is that the gums are bad. Sometimes their teeth are falling out because they have periodontal disease. There's infections in the gum. You take out the teeth, the gums heal up. Once the gums heal, you can put implants in on top of those. So you can still.
So that's no excuse then. Bad gums.
Bad gums are no excuse.
Now you are a musician, tuba player.
Well, I wouldn't say I'm a musician. I'm a tuba player.
Well, you've been playing tuba your whole life, you told me.
Yeah.
Well, then you are a musician. But you said that you've helped some of your musician buddies.
It's kind of funny because I sit next to, I play in an American Legion band, the Yankee Doodle Band. So in the band, I play tuba, and next to me I have this trombone player whose teeth have been having some problems over the years. And he keeps going to other dentists, and he said, like, I can't have this done because they tell me my teeth, I don't have enough bone for implants, and I can't do it. We put some minis in him and got him back. He's now playing as well as he ever did. But he also looks terrific. He looks back to the person that we used to look. And he thinks of himself as a ladies' man or something. And to tell you the truth, he wasn't too good for a while. He's now right back to his old self.
So do they look real? Like they end up with a beautiful smile?
You can't tell which teeth were. If you looked at him from years ago to look at him how he looks now, he looks identical. We matched him exactly where he started. And we got another guy in the band, same thing. Now, I play brass instruments. I mean, if you're doing something that doesn't require your lips, maybe you don't need good teeth. But I got another one that I've done some work on. He now says he can play trumpet. He used to say, I don't want to play that anymore because I can't do that. We fixed his teeth. He's playing things that he never could play before. He said, like, I don't know why I didn't do this years ago.
So is that what people say, by the way? Because you said this is of all dentistry, you told me on the phone, this is the happiest group of patients. It's like they want to hug you. Is that true?
It's exactly true. Of all the patients that I've seen, there are certainly, when's the last time when you do a root canal on somebody, they come and give you a hug or they come and bring you something? I help these patients out. They bring me cakes, pies, cookies. There's even one, it's so cute. This one woman who I did some implants on and made her a new denture. It changed her life so much. She went to the store and she found this little plaque and it said, life is short, smile while you still have your teeth. And she said, nice. This is you, doc, or something. And it sits right out on our front desk or something. And I use that to say, like, we changed these people's lives. The only complaint that they have, which they do have a complaint, is they say, like, I wish I knew about this years ago. Why did I wait so long?
Good. Good. And we should mention your background training. I know you went to Dartmouth and also an additional training at Harvard. If people want to know more about you, they can go to your website, obviously. You have free consultations. And we should mention insurance, right, here in the U.S. does not cover dental implants. Medicare does not cover dental implants, but you'll work with them.
Yes, Randy. When anybody comes in and they want to find out about things like that, we always do consultations for free. First, to come in and just tell you what your options are. As far as does insurance pay for implants, depends on your plan. There are some that actually cover it, but there will be usually a limit on how much per year. But we'll work with that. We have
financing and things. But Medicare does not cover this at all?
No.
Okay.
That won't cover it at all. But private insurance may cover it, and we do have financing available.
Okay, final message. We're out of time. Somebody watching this, they're either headed to dentures, meaning their teeth are bad, or they're currently wearing dentures, but they're still afraid. What's your message to them?
My message to them is the same that's come from patients. All the ones that I see, they say, this has changed my life more than anything else. Why didn't I do this sooner?
So you invite them in.
I say is, don't wait. If you can, don't put it off any longer. Come in now. Find out.
Okay, good. Thank you for coming on the show. Very good. Very
Thanks,
good
Randy.
stuff. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.